Thanks everyone for being here, and especially for our first speaker, Isto, who's joining us from Sweden. And sorry for the time zone, and thanks for for being there. So he is our first speaker with his talk on aging, everyday information and technology use. So the mic is yours.
Thank you. Welcome to listen to some musings about aging, everyday information and technology use. This presentation is somewhat speculative rather than being based on something that would be extremely well formulated or finished as a piece of work, but still something that might end up being somehow useful in understanding these three issues that are very central to information science research in many ways. The starting point for this inquiry is that when we look at the earlier information science research, both in health contexts and elsewhere, the age is quite often pointed out as a factor that affects both how people use information and also, especially outside of information science, how they're using information technologies. And even if there are many observations on different age-related differences that can be explained by changes in cognitive and physical abilities of people, experience and life situations, many of the findings have been quite inconclusive in a sense that people aren't really often, they aren't behaving like they should be in their age if we kind of keep us to a somewhat archetypal or stereotypical understanding of what people should be doing and what they are supposed to be being able to do in certain ages. And there seems to be many paradoxes about both technology use and information use with both older and younger people. One of the problems in age-related research is, of course, that many of the studies, they focus on chronological age. And for instance, as Adela and Williamson from Australia have emphasized, the functional age can be, in many cases, it can be a better indicator of how people are interacting with information and technology than their kind of chronological age. And especially if we think of elderly people, so a 75-year-old can be very functional and very active in their lives, whereas some others in the same age, they are really very old and not that active anymore. And the problem, or if it's really a problem, somewhat more probably a dilemma for both healthcare professionals in health information context and for us information researchers alike, is that the chronological age, it's a sort of an ideal proxy if it could be used to say something about what people generally tend to do and what they don't do. It's pretty easy and rather uncontroversial to measure. But at the same time, if it doesn't work, so it's not exactly very useful in practice. During the work I've conducted together with my colleagues in taking health information behavior into account, or HIBA project, funded by the Academy of Finland, on older adults and their information and e-health use, and work in the context of DOME Consortium in Sweden on e-health technologies. And especially during the time I spent at the high school at the UBC last winter, when I had a little bit more time for myself and thinking, I've sort of meandered to wonder whether there might be other complementary explanations to the differences, and especially how we could understand the differences and the changes in how information and technology related behavior works with people in different ages. One obvious question is that what was especially the starting point of the HIBA project was that there has been a fairly strong tendency to study information behavior and technology use as two separate issues. Information scientists have been very interested in information behavior, whereas information systems and computer science researchers have been focusing on technology use. And there haven't been too many points of convergence between these two lines of research, which is very much a pity. But really, it's something that should be done to a lot more to understand the both, because it's pretty obvious that the two, information use and the use of technology, is how information is mediated and how it is where it's sought and how it's communicated. So they are definitely related to each other. When it comes to technology use, one of the popular theories regarding it is that the differences in technology competencies will disappear in time when today's technology-savvy youngsters become a few years from now, tomorrow's elderly. But in contrast to the popular belief, there are many indications that the widely observed gap in technology adaptation between younger and older individuals, it can be expected to lessen to a certain extent, but it's unlikely to disappear completely. Partly because of some of the age-related differences can be traced back to, as I mentioned earlier, to declining cognitive and physical abilities. And partly, of course, because some of them can be explained by life situation. For instance, retirement, it can affect individuals' access and attitudes towards technologies. And then the different relations to people in other ages, it might also have an impact on what kinds of technologies are relevant to people when they grow older, and what they use and what they think that they need to use in comparison to younger people. Then when it comes to information behavior, there are similar-ish observations in a sense that people in different ages differ in how they seek, use, manage, organize, and create information. And in information behavior research, it's known that time is a significant contextual factor in how people seek and use information. And even if it hasn't been studied that much than many other factors relating to information behavior, there's a sort of an emerging body of research that has studied to elaborate the understanding of temporal dimensions. And here, from the perspective of this presentation, the interest is naturally on lifelong temporal scale. So there has been also new research on that topic. And there is some observations that have been done. Much of the discussion but a part of the discussion has focused on significant life events such as pregnancy or motherhood, whereas then there is another body of research that focused more on generational, collective, and individual long and short-term temporal rhymes, continuums, and processes of how people interact with information. And as a whole, it has been noted by, for instance, Savolainen and Kari, that human life can be seen as a process that's characterized by moving, changing, and evolving through time and space. And that has also direct implications to how people interact with information. But as a whole, this means that individual and collective information needs, behavior, and practices can change over time. But then the question is that what does this mean in practice, and how we can explain that beyond individual events and situations, or kind of just in the life-long scale that, okay, things are fluctuating. Then when it comes to earlier research, so there has been some interest in life events, as I said, but then there has been quite a lot of research that has tried to group people into different types of age groups, and see whether there are differences between these types of kind of groupings of people, whether cohorts are different so certain kinds of groups of people are different in their information behavior, quite simply. There are quite a few longitudinal studies. A few examples exist, but they are fairly uncommon. As the reviews of time-related information research show, there are some ambiguities in how things change. Many relevant aspects of information seeking and use change in time, including needs and states of knowledge and bodily and mental states of individuals and so on. But how they change, and if it would be possible to somehow understand and explain the change as a whole and reach some sort of a more general understanding of what's happening, we haven't kind of really come that far. In the context of the HIBA and project and the work of DOME Consortium, we have done a series of studies where we have investigated differences between quite traditionally between different age groups. And our kind of grouping of age, different age groups has been based on making a distinction between elderly people that are the kind of the really old people, and older adults that are late in their working life and in early retirement age, old but still active in their lives and mostly independent. And then in comparison to younger people, and in this context, so the younger people aren't currently really youngsters, but they are people until in their early 50s. And in these studies, we have focused on trying to figure out how they seek and use health information and how they use different types of e-health technologies, mostly focused on informational e-health technologies and EHR services. And kind of when I try to pull together all these observations, so I came to a sort of an conclusion or proposal that the life course trajectories of health information needs and the experienced predominant technology and information related challenges, they seem to converge to a certain extent, and then at the same time they seem to differ in different periods of life. And in general, it seemed on the basis of the studies that we conducted that information seems to be a challenge for younger people, especially this is the empirical work we have been doing. It's in health context, but this can be to a certain extent also at least on a level of propositions generalized to other contexts as well. Whereas technology is not experienced as a similar kind of a challenge. Whereas in later life, it seems to be that information is less a challenge, whereas technology becomes a bigger challenge. And then looking specifically at health information needs, so there seems to be there are some indications that whereas in the younger individuals have fairly few health information needs if they are healthy. Of course, if they are having medical conditions, so then the situation is quite different. Whereas there seems to be a body of emerging health information needs, especially in the stage when people are older adults, when they are seeing that their health condition is changing or it's about to change, and they begin to wonder what they should be doing with it. Whereas then with elderly people, their health information needs somehow seem to decline to a certain extent because they already they have their conditions, and if they have emerging conditions that they don't yet have, so they have still been kind of to a certain extent indoctrinated in the healthcare system and in seeking health information. So they they have certain routines how to cope with it. And one possibility how it could be kind of explained why these curves might look like as they seem to be doing is an exposure to different types of things. And in younger age, people are more exposed to technologies, and they don't have a kind of a fixed set of technologies how they would be interacting with information. So they interact with them more. They have less exposure to especially to health information at that stage, because they don't need it to a similar extent. Whereas in later life, when there's a fixed set of technologies that people have been accustomed to use, so they don't so actively go about and use and interact with new types of technologies, whereas their exposure to information might be much bigger because of their routines, how to manage their lives and get informed of various things. And the idea is, what I'm kind of sort of proposing here is that there are certain transitory periods in regarding different activities in the lives of people, and roughly similar kinds of transitory periods might be able to be spotted, let's say, relating to banking and communication. Those related to learning and studying are probably a little bit different. There, the high point of needs and exposure is probably closer to the younger age. Similarly, entertainment and hobbies might have different kinds of transitory periods. Then also, when it comes to that, there are the different transitory periods, definitely, or it can be at least hypothesized that they probably do kind of occur in different stages of life, and then the technologies and information exposure, it probably is slightly different regarding different aspects of everyday life in different phases. And in addition to these kind of big transitory periods, it might be speculated that there are also probably micro periods of transition where kind of the exposure and information needs and both technology and information related problems kind of do a smaller, there is a smaller variation and kind of smaller and lower peaks relating to more specific aspects of information and technology interactions. And of course, this is very kind of speculative work in many senses, and it's unlikely, or it's quite clear that it's not really this simple. But what I'm proposing in this presentation is really that that whether this kind of bringing together of health of health information in this particular empirical context, but more in general, information-related hurdles and technology-related hurdles, whether it might help us to think about different types of trajectories, how people experience problems in their technology and information-related interactions, and why they change, and why certain things are experienced as being more problematic in certain stages of life than some others. And having said that, so I'm concluding my presentation, and if somebody has something to ask or to speculate or to comment, so I'm very interested in discussing this.
Thank you, Isto, for the very interesting talk. I think we have ID with a question. You can go ahead, ID.
Thank you, Philippe. Thank you, Isto, for your presentation. It's very thought-provoking and I think helps us to think maybe more broadly about some of the information behavior work that that's been done in the past. I'm wondering whether you and your team have been thinking about or incorporating the work that that was done by Terry Asla and Kirsty Williamson with respect to information behavior and technology use of the elderly, where they did look at change over time in older people. And I just think that what you've been talking about really does recall that work, and it could be quite informative if you haven't had a chance to look at it.
I have looked, and we have looked at that, and it's definitely kind of one of the inspirations to kind of think about the whole thing. But now I'm beginning to wonder whether I have kind of missed something specific. So I probably have to go back to their writings. But that's a very good point, and I think they are definitely kind of really getting into something, especially when it comes to the question of precisely the interaction between technology and information related interactions, and then also the thing that we probably, on one hand, we shouldn't be kind of focusing too much on chronological age, but should be kind of thinking more about kind of what's really happening. Mm-hmm. Even though it would be kind of really nice if the chronological age would work well as a kind of a proxy, because it's so easy.
Yeah. Thanks.
We have a question from Ali.
Sure. Thank you. Thank you for the presentation. This was very interesting. One of the diagrams that you showed, the kind of intersection of, I guess, information and technology for elderly people, and you said that's it. Thank you. Yeah. So you have technology as a challenge, and then you have information as a challenge, and you argued that information as a challenge seems to be less of a challenge for elderly. And I'm just wondering, how do you explain the kind of, because technology and information are so intertwined, right? And my question is, in this day and age, with all the kind of fake and false information on the web, particularly in relation to health information that I'm sure you're fully aware of, how do you explain that information is less of a challenge, or finding information is less of a challenge? Because you're really talking about all kinds of small screen devices, mobile devices. That's one thing for the elderly to understand and learn and to use effectively. But then information sources on the web seems to be a kind of a challenge to identify and evaluate, which I guess I'm getting into territory of, Heidi's expertise in the area of digital information literacy, but they are related. I mean, technology and information are related. How do you explain that?
This kind of this diagram shouldn't be kind of interpreted as a kind of an exact kind of a depiction of all information related challenges and technology related challenges, but this is based on the observations from our studies that it and how it can be explained is in the health context, in a way that in younger age, people don't have to care that much about or think that much about their health, and they don't seek necessarily that much health information. So they kind of because they don't know what they might be needing and where to seek and what to seek. So their reflections and their survey responses, so they point to that that they are more kind of concerned or have more experience of being lost with health information. Whereas kind of when people develop conditions and become more exposed to healthcare, so they learn the ropes and become they have kind of develop routine how how to interact with healthcare, where to find information about their specific conditions, whom to ask, where to seek information, and so on. So it becomes less of a challenge. So it's really a question of exposure when you kind of learn a particular genre and a particular field of information. So then it becomes less a challenge. You become an expert in that field. Whereas with technology, because what I'm speculating here is that younger people, so they are more exposed to technology. They are trying new things for many reasons, because they don't have these routines how to seek and access certain kind of information, and they are also socially active, and probably there are many other things as well. Where in older age we do have developed our things. We read newspaper and we listen to radio at certain times and watch telly and so on. So when we need suddenly to use something completely new, so it is experienced as more difficult than before. This is of course very much kind of speculation at this moment, but this, what I'm proposing is that this could be a one way of seeing it or explaining what's happening.
Thank you.
We have Rebecca who has a question, and there's one in the chat. I don't know who was there first, but
I think the chat was there first because mine's kind of related to that, so I can go first.
Okay, so maybe I can read it for you, Isto. It's thanks for a great presentation. It's by Beverly. I'm wondering about that segment of older adults that are employed, self or otherwise. Information technology skills are high in this area. If you overlay economic needs over this chart, what would that look like? Was that clear enough?
Yeah, I think so. Yeah, definitely. Kind of, there are people who are very active when they are in their 80s, and they have the newest tablet and the newest telephone, and they are kind of tinkering with all new kinds of apps and technologies all the time. And also in the older adult age. So yes, definitely there are many exceptions, but yeah, I would probably kind of say that it's more like this is a question of exposure to new technologies, and if you are very exposed to new things all the time, so probably this kind of a curve, so it doesn't kind of go that high up and that fast up, or it might be pretty much kind of leveled. So yeah, definitely there are many exceptions. Yeah.
Rebecca, you want to go ahead with your question?
Oh, great. Yes, thank you. Thank you, Isto, for a great presentation. I was thinking about another sort of temporal trajectory that will intersect with these as well, would be sort of the increased automation of like health systems and how information is being datafied, even through like the datafication of other health info through like Fitbits and that kind of thing. So I'm just wondering, but primarily like that automation of the healthcare system and form filling, like if that's something that you're looking at as well in terms of both information needs and user behavior.
We haven't kind of really addressed kind of directly automation, or kind of automation is kind of, to a certain extent, it's embedded in many technologies that are being introduced at the moment. But I would probably kind of say that, or yes, probably mostly, that when it comes to automation, so if the automation kind of directly fits in your ways of dealing with information, so that probably doesn't end up being a problem or a challenge, and it certainly kind of changes the way how the curves would kind of work. But thinking about that, if you have to adapt and you have to kind of do something differently with a system that's very much automated, so probably it's going to have your relation and how you kind of feel or experience it, so it can be equally challenging or not challenging than something else.